This video demonstrates how to set up and use the Ballard Mini Bowel Sampling Catheter. The Ballard Mini Bowel safely samples a patient's lower respiratory tract secretions, giving physicians the data that they need to make an accurate lung infection diagnosis and prescribe targeted antibiotic treatment. Prior to the procedure, perform closed suction. Make sure the patient is off all enteral feeding for 1 hour and turn the patient to 100% oxygen for 10 minutes. This is a clean procedure, treated as a sterile procedure, and is best performed with 2 people. All of the equipment necessary to perform the mini bowel procedure can be found in the Ballard Mini Bowel Prep Pack. The supplies can also be collected separately. You will need a dressing pack, a blunt tip needle, 2 50 milliliter syringes, 100 milliliters of sterile saline, a specimen trap and label, and a 13 or 16 French mini bowel sampling catheter. Wash hands and don appropriate protective equipment. Open the mini bowel package, maintaining sterility. Inside of the package you will find the mini bowel sampling catheter, an elbow adapter, and the suction tubing adapter. The remaining items in the package are not necessary for this procedure. Remove the white tip protector from the tip of the mini bowel catheter. Attach the suction adapter to the distal end of the 3-way stopcock. Put the blunt tip needle on one of the syringes and draw 20 to 40 milliliters of sterile saline, according to facility protocol, into the syringe, leaving 5 milliliters of air behind the saline. Then, using the blunt tip needle, draw an additional 20 to 40 milliliters of saline into the second syringe. Attach the specimen trap to the suction adapter, and then attach the wall suction to the specimen trap. Attach the saline and air-filled syringe to the 3-way stopcock. Lay the dressing over the patient's chest. Insert the catheter into and through the access port elbow. To prevent the catheter tip from hitting the ET tube adapter, extend the tip of the catheter approximately 1.5 inches or 4 centimeters past the elbow adapter. While supporting the stopcock, syringe, and specimen trap, have a second person assist with disconnecting the ventilator circuit from the endotracheal or tracheostomy tube. Quickly attach the elbow adapter to the endotracheal or tracheostomy tube while guiding the mini bowel catheter into the lumen, and then reattach the ventilator circuit. Position the catheter's directional tip for the right or left lung by rotating the oxygen port to the desired side. For example, with the oxygen port oriented to the left, the catheter's directional tip will be positioned for the left main bronchus. Conversely, with the oxygen port to the right, the directional tip will be positioned for the right main bronchus. Advance the outer catheter of the mini bowel until the markings on the catheter match up with the number on the ET tube, and then advance another 5 centimeters so the catheter is positioned on the left or right main stem of the bronchus. Clear the tip of the catheter by instilling 2 milliliters of saline through the catheter. Hold the outer catheter in place and advance the inner catheter until resistance is met, and then pull back slightly. Lock the catheter in place by pushing the blue slide lock on the elbow adapter downward. Fully depress the plunger on the syringe to irrigate the lung. Turn the stopcock to the sputum canister position to suction sputum into the specimen trap. Repeat with the second saline syringe if more sputum is needed. When enough sputum has been collected, turn off the suction, open the blue slide lock, and withdraw the mini bowel until the tip can be seen in the elbow adapter window. Do not fully withdraw the catheter. Remove the mini bowel and elbow from the circuit and reconnect the ventilator. Disconnect the specimen trap from the suction adapter and seal the specimen trap. You can do this by connecting the tubing or by placing a cap on the specimen trap if you have one available. Mark or label the specimen to be sent to the lab. Disconnect the syringe from the stopcock and discard the catheter and syringes.